Each year, the American Cancer Society estimates more than 240,000 women are diagnosed with breast cancer. That's about 1 in every 8 women in the United States. But not everyone knows what causes breast cancer or how someone gets it. In fact, there's a lot of myths out there. After all these years, there are still myths out there, and that's why Dr. Ronald Downs is here to reveal what's fact and what's fiction about breast cancer on this month's edition of Health and Beauty Breakdowns. Thank you for coming on the show, Dr. Downs. It is troubling to think that there are still some incredibly disturbing myths out there that people believe.
It is incredible, and and October's Breast Cancer Awareness Month, so it's important that it's very apropos at this point to start talking about some of those myths. And first of all, what is breast cancer? Breast cancer basically is just an abnormal growth of tissue or tumor cells or cancer in the breast tissue itself. Now, this is what we call a heterogeneous disease. Heterogeneous means that it can affect all individuals, it can affect many different age groups, and it can affect, well, actually, it can have different kind of cells within the tumor itself, which makes it appear completely differently.
So there are important warning signs, though, that we encourage women and men to be aware of.
Well, the warning signs are important because mammograms now we're using more and more frequently, and we're finding breast cancers earlier before symptoms occur. But you have to remember that a lot of breast cancers don't appear on mammogram. They appear by symptoms alone. So the most common symptoms of breast cancer are a change in the feel or the appearance of the breast, a change in the feel or the appearance of the nipple, or even a nipple discharge. And there are some other warning signs, such as a lump, a hard knot or thickening in the breast, a swelling or warmth or redness, a darkening or like a discoloration in the breast, change in the size or the shape of the breast. Important, dimpling or puckering of the skin, what we call skin retraction, itchy, a scaly rash or soreness in the nipple, or a nipple discharge that starts new, or even a pain that's there that just doesn't go away. And those are all things that can occur that are signs and symptoms of breast cancer. And when you find those, it doesn't mean the important part there is go to seek care if you find those things.
Right, because you don't know. And if you have any kind of suspicion, get it checked out, right?
Absolutely. Many women are very fearful of that. When they find something in their breast, they won't go to see the doctor for fear of what they might find.
Yeah.
But it's really time that at this point you really need to take charge of your health care and go and find information from your physician, get your mammograms annually, and do regular self-examinations.
Yeah, and information, you just touched on that.
Right.
Don't listen to these myths out there. You have some important myths that we need to debunk right now.
Well, first of all, everybody's at risk for breast cancer. All women are at risk. As you said before, 1 out of 8 women is our incidence here in the United States. And it's not discriminating.
Right.
Breast cancer can occur in all different types of races. It's the most common cancer in Caucasian women, African American women, Chinese, Japanese, Filipino, Korean women. As a matter of fact, in the last 2 decades, there's been a marked increase in Native American women. But there are some real big myths. For instance, if you find a lump in your breast, you have breast cancer. Interestingly enough, most lumps in your breast are not malignant. 8 out of 10 breast lumps are not malignant. So if you find a lump,
get it checked out.
Get it checked out by your physician.
And be reassured by that statistic, because 80% are going to be just fine, but it's worth getting checked out.
Don't be afraid to go to the doctor to get it checked out. That's the biggest mistake you can make. Big myth, men don't get breast cancer. Men absolutely can get breast cancer.
Absolutely, and they need to be aware of all of those changes in the breast that women are.
Just as many. And as a matter of fact, the American Cancer Society will estimate that about 1,700 men will get breast cancer this year. But of those 1,700, 450 will die.
Wow, because they didn't get that detection early?
Men's breast cancer is far more aggressive than women's breast cancer. They don't get it as often, but when they do get it, it's very serious. So men, check self-breast examinations just like women would do on a monthly basis. Another myth, mammograms can spread breast cancer.
You're kidding. People believe this?
Absolutely. Many women are afraid to get their mammograms because they're afraid that the compression of the plates during the mammogram will cause breast cancer.
Wow.
The biggest message here is please do not let other people's horror stories or myths
because it can be uncomfortable.
It's a little uncomfortable, but believe me, the alternative is worse.
Yes.
So the breast cancer, the mammogram is the best screening that we have, and really go by the recommendation of your doctors, not what other people are telling you.
That family history myth, I think, is an interesting one.
Right. If you have a family history of breast cancer, it means you're going to get breast cancer. Absolutely not. Although you're at higher risk for breast cancer if you have a positive family history, you need to be aware. But remember, a majority of women that get breast cancer have no family history.
Yeah.
So if you have a daughter, a mother, a sister, a grandmother that has breast cancer, the key there is early detection. Start getting your mammograms about 5 years before their age of detection or at your age of 35, whichever becomes earlier. That's important.
I can't believe this last myth. People actually believe that breast cancer is contagious.
It is unbelievable. Breast cancer is not contagious.
No, you can't catch it.
You can't catch it by touching somebody with breast cancer. But, what breast cancer is an uncontrolled growth in the breast of tumor cells. It is not contagious. If you want to protect yourself from breast cancer, what you need to do is get mammograms regularly, do self-breast examination, and establish an ongoing communication or with your physician to make sure that you are educated about breast cancer and know what it's all about.
Dr. Downs, that's all the time we have, but thank you so much. This is important information that we shared this morning. And if you'd like to see more health and beauty breakdowns, you can email us some ideas at 16morningnews@WNDU.com. Thank you, Dr.